Good morning, everybody. How's it going? So, just finished my morning workout. It's 7:26 here, Mountain Time, out here in Eagle, Idaho. And I was thinking about something as I was finishing up. I was reflecting back to a conversation we had yesterday with Dr. Lanny Nelson, who teaches for Protec Spine, which is this new piece of equipment that we got in our clinic. He came up from Utah to do some training with us. So with me, Dr. Zach David, our exercise therapist, and he took us through some cool protocols. I had a couple patients come in and he set them up and showed us a couple of different assessments and things that he would do for them. But we had some conversation, and so he's practiced for, I believe, over 40 years. He taught at Logan, and he went through our clinic, and he said, this is just such a beautiful clinic, and it's so great how you laid it out. And he said, I've taught so many students, and something that is disappointing is that there's such a high failure rate in chiropractic, and it's so nice to see someone who's doing well. And I said, well, that's great. And I said, more so, that was one of the motivations for us systematizing everything that we do in practice, was so that it could be interchangeable, so that I could eventually start to phase back a little bit or work on some other things that I want to work on, and have a associate doctor come in, or two or three, or whatever the future would hold, to take over and carry the reins. And so now that's something that we've successfully done. We have Dr. Zach here in our clinic, and he covers and sees patients for me. He has his own practice, patient base, and very, very seldom do I have a patient that has any sort of issue seeing him over me. Now, let's talk about that a little bit, because in the title of this, I said something about how to use functional movement to make your clinic not personality dependent, right? Personality dependent means what? It means that a patient comes in and they only want to see you because you have that charisma, you have that smile, you have that skill, that technique, that touch with your hands, for example, and they don't want to see anyone else. So now that's something that I've seen that over the years. I worked in a group practice out in Albuquerque, New Mexico. We had 6 doctors in 2 clinics, and we saw that all the time, where we would cover for each other, and the only thing that we had to deliver to the patient was the adjustment. Very important thing, yes. However, in the patient's mind, they're coming in only for the adjustment. They only want to see you because you have that touch. You might adjust a joint a little bit better than someone else who hasn't been in practice as long, or maybe just doesn't have has as much experience working with you. And so they just want to stick with you, and that's nice, that's flattering. However, that's also called prison, because that means that you'll never get freedom, you'll never be able to take a vacation, you'll never be able to step back and have someone else carry the reins, because everyone just only wants to see you. Now, that's not a fantastic way to practice. I practiced like that for several years, and as I got more into curve correction and then functional movement, we realized that we had these other things that we were offering a patient, which was really nice. Doesn't mean that the adjustment is not important. It's very important. However, if the adjustment isn't identical when someone else is rendering it, maybe they don't get the joint to move quite as well, they don't set it quite as deep, whatever, the patient is still spending a certain amount of time in your practice, and a good majority of the time is spent working with your team, people who are familiar to them in the exercise area. If you are doing curve correction and traction in-house, in the traction department, they're working with this other team, and one piece of that is them checking in with the doctor. So it makes it a much easier transition for you to be able to have someone else cover for you, or you cover for someone else. It makes you more interchangeable, which is nice. So anyway, that's my intro to this. Now let's talk about what it is really that enables someone to be interchangeable. And I believe it's not just having 3 different departments in your clinic, or 2 different departments. Most of our doctors, I just want to clarify, most of our Move Now chiropractors who are using our systems, who are part of our whole community, our program, most of them don't do curve correction in office. Most of them are not doing chiropractic biophysics. They might do home care curve correction, which I strongly recommend at least doing that for sure. But they're doing functional rehab in office, and then they're doing whatever adjusting methods and techniques they do in-house, and they're addressing posture to some extent, whether it's a postural corrective exercise, home care, traction. But essentially, it's what they're talking about in their model that makes them so unique and different. And that model, you can see it behind me, even though it's backwards, because this is Facebook Live from my iPhone, so it flips it all around. Here, I'll flip my camera around and show this to you as I'm talking. Let me just go like this. Get ready. Get ready, everyone. All right. We'll flip you around like this. All right. Let me go over here. All right. This right here, this is like literally the first drawing I made on this notepad paper a long time ago. And it says segment, posture, movement. Segment, posture, movement. This is what we explain to patients all the time. It's our model. It's how we differentiate what we do. Immediately when we explain, hey, here's what we do in this clinic. There's 3 different pieces of this. We do a very specific type of chiropractic. That's where we check and we adjust the individual segments in your spine or even in a extremity joint. That's the segmental approach. When a segment gets injured from a trauma, that causes regions in the spine to shift and distort and weaken. It's called a postural distortion. We also look at that. We measure that, and if it's abnormal, that's a problem because that is going to inhibit the segment from ever getting stable and healthy. Does that make sense? Yes. So we have to address the posture as well. You can see why we also look at posture as well as the segment, right? Right. Okay, now there's a third piece to that. Even after we fix the segment, we get it moving properly, there's good joint integrity, and we improve the curve or we address that curve or the posture, right? Do you think that means someone's completely functional? They can bend over and touch their toes, they can lift something up properly, they can exercise to whatever type of exercise regimen that they like without fear of injury or dysfunction? No, it doesn't mean that. That third component, which is movement, is huge, and I would argue is where a lot of this stuff begins, meaning abnormal movement, dysfunctional movement, moving the wrong way, bending the wrong way, having improper movement, and then trying to go through your normal activities and not being functional in your normal activities. That is typically how one gets injured. That's how the wheels fall off and things start going downhill. So we look at segment, we look at posture, we also measure how you move. So we check how you move, we see, are you moving within a certain set parameter or level of criteria that's within normal limits? And if you are, great. Then we start seeing, how do we improve that? How do we build some strength? How do we build some power? If you're not moving properly, we have to identify that. We have to reverse engineer where it went wrong. So we have to break that out and find out what little piece went wrong. Is it a problem with a joint, which leads us back to segment? Is it a problem with a tissue, okay? Like muscle tissue, musculotendinous junction, fascia? Is it something like that as far as tissue? Or is it a motor control issue, brain issue? Meaning that your brain just doesn't know how to get your body from point A to point B properly. You've compensated because of injury. Maybe you never learned how to move properly to begin with. Maybe you were a very uncoordinated child and teenager and grew up to an uncoordinated adult. So is it joint? Is it tissue? Is it brain? Or is it a combination of all 3, right? Now, granted, I don't go through this in-depth of an explanation when we're talking to a patient. I'm just breaking this out for all of you guys on this right now. However, that's the way we think about this, we talk about this. We have various talking points that happen multiple times a day with new patients, with existing patients, explaining how they're injured, explaining why they're going through care, why they're doing home care, why they should stick with this, why they're going into their second phase of care, why their family should get checked out. It's segment, posture, movement. And how long should you maintain, or should say this, how long should you be getting your spine checked, adjusted, and have your movement monitored and your posture improved? How often should you do that? Well, how long would you like to have a strong and healthy body? How dedicated are you to having a strong and healthy body for a lifetime, right? Those are questions that we ask a patient. Those are very powerful questions. And that's when it clicks. How long do you want a strong and healthy body? Forever? Right. So they can answer their own question as far as how chiropractic, how segment posture movement, how the integrity of all three of those fits into an overall health model. I'm going to flip this around again so I can see all of you guys. All right. There we go. Back here. All right. Good morning, Dr. Brandon, and everyone else who's on here that I can't see your name on the bottom. For whatever reason, it only shows me certain names, but I'll call out the names that I can see. All right. I'll put this down a little bit. So anyway, in this conversation yesterday, here's what Dr. Lanny was talking about. He was saying it is disheartening to see so many chiropractors who either fail in practice or those that are personality dependent their entire time. They never have freedom. They can never get away from their practice. They can never take a vacation. No one can ever cover for them. If they're not there, patients don't show up. And so I interrupted and I said, well, I understand what you're saying. And I think what we've created is a very viable solution to that. And we've proven it in our own practice, and other doctors have proven it in their practice. And in thinking about that, I thought that's a good topic to at least bring to a discussion like this of, if you've been in practice for any length of time, even if you're new, one day you're going to get to this point where you're going to want to take vacations, you're going to want to possibly bring in an associate doctor or multiple associate doctors. And the best way to do that is to have systems in place that are interchangeable, where a patient walks in and they have departments in the clinic. They have different things that they do so that they can resonate with the staff. They can resonate with, David, our exercise therapist, and Derek, who was back there, who just left our team yesterday to move out of state and then end up going to chiropractic school. So good for him, but he'll be missed. So see you later, Derek. So David, Derek in our exercise department, April, our billing manager, our front office, Bailey, our office manager, Brandy, doctor assistant, new patient coordinator, Jenna. They have all these people, Hunter in traction. Sorry, how can I forget Hunter? Hunter in traction. These patients love our team and they get to know the team, but even more so than just the people that are part of the team, they get to know the process in each department. They know why they come back into functional movement, and they do their spine warm-up exercises first. They get moving, right? Something that Dr. Laney was saying yesterday is that our goal is to put the best product on the table, meaning we get them moving first before they get on the chiropractic adjusting table to get adjusted. So we do things to warm them up and get them moving so we can deliver a great quality adjustment. Patients understand this. They do their spine warm-ups first, right? They see familiar faces. They then go back, they get checked, they get adjusted, they come back into the exercise area and they go through their postural corrective exercises. And then they go into their functional movement protocols that they're either refining and perfecting that they have learned in a previous visit, or they're learning a new protocol that's taught to them that day. Then they transition from there, they go into the traction department, they get set up into their specific traction based on what kind of abnormal spinal issue we've discovered early on. Then they ice and they're done, right? Now a piece of that is they get checked and adjusted. So in a couple weeks, I'm gonna go out of town for a couple of days. I'm gonna take a couple of days off. Dr. Zach's gonna cover for me. And a vast majority of my patients will keep their appointments and come in and see him because they know they need to keep on track with their care. Some of them are really tough to adjust, and it is unreasonable to say that Dr. Zach and I have the exact same adjusting skill level, just like when I worked with my mentor in New Mexico. I mean, I was always trying to get better and better, and he had years of experience on me. But Dr. Zach does a great job, and most of our patients don't really discern a huge difference. Sometimes I'll come back, they'll say, oh yeah, it moved well, it did well, yep. Or they'll say, oh, it didn't move as much, but yeah, I did really well. And every once in a while you get someone that said, yeah, it didn't really move all that much, but I think I was a little tighter that day. And then you might have 1 out of 100 people that says, yeah, I really don't want to see anyone else if you're not here, okay? 1 out of 100 is not bad. So that's something that's gonna happen in a couple weeks. I am really fortunate that we have these systems and patients understand the premise behind addressing segment posture movement, the systems behind this that also reinforce this. This is another thing that I was explaining to Dr. Laney yesterday, when he was in our clinic and we were having this conversation, I said, something else that we've successfully done, which is so vitally important in a chiropractic practice, and this is what all of you need to do in your practice. I'm just telling you this. I heard this years ago. It made a lot of sense to me. I didn't know how to do it, but it made sense to me, and I knew I had to do it, was create a culture in your clinic. And so how do you create a culture in your clinic? Best example, maybe some of you have seen some ads we've been doing on Facebook recently about trying to get the attention of people to say, love it or hate it, what did CrossFit do really right? CrossFit created a culture within fitness. They created a culture, people are amped to work out, they make it competitive, they make it a team sport, even though it's an individual, working out's an individual thing, right? They've created this team type of sport, yet still kept it individual. And they've created, like I said, a culture. People are excited to go in and see their buddies and hit different styles of workouts or routines, or I don't know all the lingo exactly. And that's a similar thing that we've done in Move Now University, and that's what you can do in your practice, is that we have a belt system of functional movement. So patients come in, they start at a white belt. We explain this to them. You're at a white belt. Our goal, your goal, needs to be to get to a blue belt, which is the third belt level, within 12 weeks. So as you go through this 12-week transformation, that's another thing that's culture-based. We have a title to a program called the 12-week transformation. Patients talk about it. They call on the phone as new patients. They say, yeah, I want to go through this 12-week program that you have. So the 12-week transformation is an online membership site that we built. We cloned this over, so all of our Move Now chiropractors have a 12-week transformation set up in their clinic as well. They customize it to their clinic. It's very simple to do based on how we built it. And there's a home journal. There's a journal that the patients get as well. They take this journal with them home, and they take it back into the clinic, and our team instructs them on what they learned that day and what they should be aware of, and then they will write in their journal, and they use this as like a progress journal. That's a culture. You created a culture. You give them resources as far as something that they can go and log into. They are aiming to get a different belt level. It's comprehensive care. Now, something that in this conversation we had yesterday, something that Dr. Laney was saying, is he said they've done the polls, they've done the research, and they show that pretty much any patient at any given time will leave you as a chiropractor for $2.73 or 7 miles of convenience. Meaning they find someone that's closer to them, or they find someone that's $2.73 less, they will leave you, according to this poll of like thousands of patients who were asked this. I'll tell you, that's not going to happen to us. It's not going to happen in our practice. It's not going to happen in your practice if you create a culture. You create a culture, people are going to be with you for a long time, if not for life. Why is that? Because no one else has done that for them. No one else has provided that for them. And that's something that was introduced to me years ago. And like I said, I knew we had to do it. I just didn't know how to do it. And the keys to doing that we figured out is the belt system. You have a program that they can log into, that they can look at when they're outside the clinic, so they're always thinking about you. It's competitive. It's kind of like a curriculum, as far as like almost like schooling, right? There's a joke we even make with our patients. We say, we're going to take you through a minor college curriculum course in overall health and spine health in the next 12 weeks. So as you go through care, it's not just you're paying for care and you're investing time to come in and go through treatment, but rather you are learning principles and you are setting a foundation in your spine, in your body, that is going to last for the rest of your life. You're going to build habits, instill habits that you're going to use for the rest of your life. Doesn't that sound powerful? Doesn't that sound valuable to you? And those are questions we ask a patient, and they say, yes, absolutely. And then that's what we remind them of, so that if we ever notice moments of weakness where they start to regress or it's tough for them to build a habit, we remind them. We say, do you remember what we're doing here? Do you remember what we're trying to accomplish in these 12 weeks? These 12 weeks are the beginning of setting a foundation for the rest of your life to be strong and healthy for a lifetime, for you and your family. These are principles that you are learning, that you are going to bring to your family. Just last week, I've been taking care of mom in this family for, I don't know, close to 6-7 months initially. She was referred in by a neurosurgeon here locally. That's pretty cool, right? So neurosurgeon sent her in. This is a neurosurgeon that has toured our clinic. I've been in surgery with him a couple times watching. He's a skilled guy. He doesn't like chiropractors. He understands what we do. He likes what we do. So we're slowly loosening him up to understand that chiropractic is awesome, right? He just didn't understand it because I don't know what type of perception he had or who he was dealing with, but he understands segment posture movement very, very well. Anyway, he sent her in, and she referred her daughter in, who had a bunch of issues with like restless leg syndrome. She's young too. Restless leg syndrome, which wasn't even a diagnosable thing when I was in chiropractic school. And I'm not that old, but started school in year 2000. So she had all these issues. She had been to doctors. No one could help her. Anyway, she's like 90% better. She's significantly better now. And mom and daughter were patients. She's got 3 daughters. Why are the other 2 daughters not there? Because I didn't do a good job talking about it probably. So I failed in this part. However, she came to her own conclusion. It snapped like last week, and she said, I'm gonna get my daughters in and I'm gonna get my husband in. So now we take care of the entire family. So last week we had 2 of her other daughters come in, her husband came in, did a workup on everyone. Everyone's got something going on in slightly different ways. They all already understand the importance of this. They've all mentioned to us that, oh yeah, we see mom watching these videos, we see mom doing her home care. So they've already been loosened up or exposed to this, so to speak, so that now as they start to do this, it's going to be a very easy transition. So anyway, what is this squeaky brakes out there, some car, I don't know if you can hear that. Anyway, that's the main thing I wanted to cover, is that if you want to have freedom in practice, if you want to be able to be reproducible, be able to go out of town, have an associate doctor take over for you, or just have patients that aren't putting all their eggs in one basket, which is just seeing you. If you want other departments in your clinic to be rendering services, helping your patients to a higher level, generating more revenue while you're in your room adjusting your patients, that's pretty much what we've put together in Move Now. You can watch a demo that talks about it. If you haven't watched the demo yet, opt into it. Go to demo.movenowyou.com. When you opt in, you'll put in actually a cell phone number. It'll send you a link so you can get back into it at your convenience. And also that cell phone number, which is really cool how we set this up, is that it'll send you a text message and just say, hey, I saw that you opted into this thing. And then you just reply, and now you're connected directly with me, okay? Sometimes a couple other people on our team help take over. If they do, they'll identify themselves, but right now it's set up, it connects straight to me. So if you have a specific question for me, let me know. And if you don't want to talk to me at all, that's okay too. You can just watch the demo, it's totally fine. But check it out, see how it works. I think you'll start to picture how this could work in your practice. If you don't already have a fully functional exercise department in your practice, when you see the systems, it'll build the confidence inside you to say, I could do this. I could see this thing working. Back before I ever put exercise in practice, I remember it seemed like such a daunting idea to think, how am I going to get patients to want to do this? How am I going to get them to want to come into the clinic for this long? Is this something I'm just going to offer to some patients, or is this going to be like the core basis of how I practice? How does this jive with what we do as chiropractic? How am I going to explain this? How am I going to find staff? How am I going to hire the staff? How are they going to figure out protocols? How are they going to keep patients engaged the whole time and make them want to come in for their appointments and excited to come back for their next appointment? How am I going to build this? Those are all questions. Those are all things that we built systems for. We've been through it. I have not met anyone who has practiced with systems quite like this. So it's a very unique thing that we've put together. So I'm not trying to say that to toot my own horn, but I'm saying this to hopefully pique some interest in those of you that have not checked out the demo yet. So check it out. Let me know what you think. Check it out. Shoot me a text message. Just give me some feedback. Say, not for me. I don't really see how this could work for me. Or, hey, I'm interested. Hey, how do you think this would work if I only had a 15 by 20 square foot or a 10 by 10 square foot room? Ask me those questions. I'll be happy to reply, give you some answers on that. Post some questions up in this Facebook Live if you'd like. If you're hearing this on a podcast in the future, reach out to us. You can shoot me an email, drtodd@movenowyou.com. Lots of ways to get a hold of us. We're totally accessible. I practice full time, but in every minute that I'm not practicing, I'm talking with chiropractors. We've met a ton of great chiropractors since we started this. It's been a ton of fun. We've built an awesome community. I'm excited to do this. Just finished my workout here this morning. This Facebook Live is coming to an end now. So I'm going to flip this off. Over and out. Have a great weekend, everyone. Talk soon.